Good evening, students. So, in this second part, this is the second part of the video, hormonal regulation of GFR, right? In the previous portion, we discussed about the hormones angiotensin 2, histamine, dopamine, and atrial natriuretic peptide. In the second part of the video, we are going to discuss the rest of the hormone which help in regulation of GFR. So let's discuss them one by one. Hormonal regulation of GFR. Now, what are the other hormones which help in regulation of GFR? One important hormone is endothelin, right? Endothelin. Now, endothelin is a very potent, one of the most potent vasoconstrictors, right? Now, if it constricts your afferent arteriole, it will lead to reduction of GFR. So, being a potent vasoconstrictor, it constricts the afferent arteriole, leading to reduction of GFR. Right? Of course, one can argue that it will also lead to constriction of the efferent arteriole, leading to reduction of GFR. But overall, this effect predominates, that it leads to constriction of the afferent arteriole, leading to reduction of GFR. Other hormone is nitric oxide, NO, right? Now, NO, as all of you know, it is the end product of many drugs also, sildenafil, nitric oxide, and it is a potent vasodilator, right? So, being a vasodilator, it dilates the afferent arteriole, leading to increase of GFR, right? Okay. Apart from that, there is also a very important chemical, adenosine, right? Adenosine is very interesting chemical that it will cause vasoconstriction or vasodilation, depends on where it is acting, right? In cerebral circulation and coronary circulation, it leads to vasodilation, but in kidneys, it leads to vasoconstriction. At present, we are discussing about GFR, we are dealing with kidneys, right? So, adenosine will cause vasoconstriction in kidneys, right? By causing vasoconstriction of the afferent arteriole, it reduces the GFR. So, adenosine will reduce the GFR. What adenosine will do? It will cause vasoconstriction. And by causing vasoconstriction, it will reduce your GFR. It will reduce your GFR. Right? And we will do vasodilation. And endothelin will do vasoconstriction. Right? Up to now three hormones we have discussed. Endothelin is a potent vasoconstrictor, it will reduce your GFR. Nitric oxide is a potent vasodilator, it will increase your GFR, right? And adenosine is a potent vasoconstrictor, it will reduce your GFR. Apart from that, one important hormone is your bradykinin. Now, bradykinin is a potent vasodilator and it will increase your GFR, right? Bradykinin. Bradykinin is a potent vasodilator and it will increase the GFR. And it will increase the GFR. Right? Now, apart from these hormones, which other hormones actually help in regulation of GFR? Now, one very important hormone is your cortisol, right? Glucocorticoids. Now, cortisol leads to increase in the renal blood flow. An increase in renal blood flow will increase your GFR, right? So, cortisol. What cortisol will do? Cortisol will increase the overall renal blood flow. Renal blood flow will increase, and increase in renal blood flow leads to increase of GFR. Now, which other hormone is also important in regulation of GFR? One very important hormone is prostaglandins, right? Prostaglandins. Now, prostaglandin is very important in regulation of GFR for multitude of reasons, and I'll try to explain. Prostaglandin actually numbs the effect of other vasoconstrictor. Like your angiotensin 2 is a strong vasoconstrictor. Prostaglandin will numb the effect of angiotensin 2. Your catecholamines, the adrenaline, noradrenaline, they are also potent vasoconstrictors, but prostaglandin will numb the effect of catecholamines. If this effect is numbed, it will ultimately lead to vasodilation, and vasodilation will lead to increase of GFR, right? Apart from that, prostaglandin also leads to relaxation of the mesangial cells, and relaxation of mesangial cells will increase your effective filtration surface area, and this will also increase your GFR. So it has got a two-pronged effect, right? So prostaglandins, what it will do is that both your catecholamines and angiotensin 2 both these has got what kind of effect? They cause vasoconstriction. Now prostaglandin, what it will do? It will numb this effect, right? It will inhibit this effect. And by inhibiting this effect, what it will cause? It will cause vasodilation. And with the vasodilation, what it will lead to? It will lead to increase of GFR. Right? Apart from that, prostaglandin will lead to relaxation of mesangial cells. Relaxation of mesangial cells. What it will lead to? The relaxation of mesangial cells, it will lead to increase in effective filtration surface area, FSA will increase. And since the effective filtration surface area has increased, this will also lead to increase in GFR. Okay? So there are multitude of hormones which help in regulation of GFR. Endothelin, it is a potent vasoconstrictor which leads to decrease in GFR. Nitric oxide, it is a potent vasodilator which leads to increase in GFR. Adenosine, it causes vasodilation in brain and cardiac tissue, but it causes vasoconstriction in kidneys. Since it causes vasoconstriction, it will lead to reduction of GFR. Bradykinin, it is a potent vasodilator, so it causes increase of GFR. Glucocorticoids, it leads to increase in renal blood flow, which leads to increase of GFR. Prostaglandins, it will numb the effect of catecholamines and angiotensin II, causing vasoconstriction. Since it blocks vasoconstriction, it will cause vasodilation, which will lead to increase in GFR, right? Apart from that, you have got prostaglandin will leads to relaxation of the mesangial cells, which will increase the effective filtration surface area, which will increase your GFR, right? So hopefully this video helped you in understanding how these various hormones lead to regulation of GFR. Okay, wish you all the very best. Thank you.